Hello, this is the Agape Project, and I'm author and minister Cynthia Harris. The Tosop Ministries, we decided to put together a page dealing with people that are caregivers for elderly loved ones, whether they have dementia, Alzheimer's, they're handicapped, or they've had some sort of stroke or other injury. We wanted to put together a page where we can come together and pray for one another, lift our loved ones up, discuss, have a discussion page, learn different things that are going on, share different remedies and things that we've learned. So we wanted to get together first of all and talk about what dementia is, what Alzheimer's is, brain tumors. Those are the three that are affecting my mom. So I wanted to kind of cover those. She doesn't have Alzheimer's, but she does have dementia, and she has a brain tumor, and her brain tumor is the cause of her dementia. So we wanted to get into this page and discuss it. Probably going to take a couple of weeks to just kind of get the mechanics of everything out of the way, and then we can begin to actually start the discussion about the loved ones, and begin to have prayer chains, for our loved ones going on. So I just wanted to kind of put this page together, and it was just on my heart to start it. I don't know what God is going to do with it, but we're excited at Toast Ministries that this is something that we can do. I mean, I just really felt the urge. With taking care of my mom, I really felt the urge to put something together where other people can come and just get relief and realize you're not feeling the way you're feeling by yourself. You're not the only one that's feeling that way. Some days are very frustrating, but I think if we educate ourselves on what we can and can't expect from our loved ones, then it'll make the transition a lot easier. We want to also talk about hospice and their role. I am so grateful that my mother is finally enrolled in hospice. I had a misunderstanding that hospice only comes in when they're getting ready to actually pass away. But some people have been on hospice for well over a year. They come in, they actually help. They bathe my mom 3 times a week. The nurse comes in 2 to 3 times a week. She has a massage therapist, and my mother's not very touchy feely, so I didn't think that she would like it. She absolutely loves getting her massage every week. She takes a nap afterwards, and she feels so much better the rest of that day. They have people that come in and help you keep your house clean. I don't really have that problem, but there are people that will come in and do that for you. The hospice, if you don't have your loved one on hospice, you might want to really consider calling and getting them enrolled in it. They'll take care of medications, they'll bring in hospital bed, wheelchairs, whatever you need, they'll bring in for your loved one. So please, if you don't have your loved one on hospice, get them on the hospice program in your state, in your city. Talk to your loved one's physician about the hospice program. You will feel so much better. You'll be so much relief, and they'll take so much pressure and so much anxiety off of you. So now we want to get on into this. I'm going to look at my notes a lot, so you'll see me looking away from the camera because I want to make sure that I'm actually following it. We're going to first talk about dementia, and then Alzheimer's, and then we're going to get into brain tumors. We're not going to talk a very long time about it, but we want to kind of get this out there so we can go ahead and get into the mechanics of what we're doing. So we might take this week and next week to discuss these. We'll probably have to do it in 2 sessions of about 10 minutes or so. First of all, let's define what dementia is and what dementia is not. Dementia is not a single disease in itself, but a general term to describe symptoms such as impairments to memory, communication, and thinking. While the likelihood of having dementia increases with age, it is not a normal part of aging. Before we had today's understanding of specific disorders, we all assumed that we would always hear old people say, "Oh, she's just senile." I actually thought senile and dementia were the same thing. Well, they're not the same thing. Senile is just a natural part of forgetting things. Dementia is another entity in itself. Light cognitive impairments, by contrast, such as poor short-term memory, can happen as a normal part of aging. We slowly start to lose brain cells after we age beyond 20 years old. That I also did not know. This is known as age-related cognitive decline, not dementia, because it does not cause a person or persons around them to have any problems. Dementia describes 2 or more types of symptoms that are severe enough that affect your daily activities. Symptoms that are classed as mild cognitive impairment, which unlike cognitive decline are not a normal part of aging and do not qualify as dementia either. Since these symptoms are not severe enough for some people, though, the milder disease leads to dementia later on. A lot of things will go unnoticed, and it will actually lead to dementia later on. All dementias are caused by brain cell death. A neurodegenerative disease, progressive brain cell death that happens over a course of time, is behind most dementia. Nerve cells or in the brain, loss or damage can cause dementia. Alzheimer's disease is the leading cause. But as well as progressive brain cell death, like that seen in Alzheimer's disease, dementia can be caused by head injury, stroke, or brain tumor, among other causes. Some causes are simpler to understand in terms of how they affect the brain and lead to dementia. Vascular dementia results from brain death cell caused by conditions such as cerebral vascular disease, for example, a stroke. This prevents normal blood flow and deprives the brains of oxygen cells, which can be the onset of dementia. Injuries of post-traumatic dementia is directly related to brain cell death. It can be caused by injury. Some types of traumatic brain injury, particularly if repetitive, such as those received by sports players, have been linked to certain dementias appearing later in life. Evidence is weak, however, that a single brain injury will raise the likelihood of having dementia or degenerative dementia, such as Alzheimer's disease. This is the reason why I'm an NFL fanatic. I love the Baltimore Ravens, and I am just a football girl. This is the reason why the NFL is beginning to crack down on concussions with players, and they're beginning to crack down on the defensive players on how hard they hit, because now they're realizing that as players get older, after they hang their cleats up and put their helmets on the shelf, a lot of them are developing Parkinson's disease, they're developing Alzheimer's, they're developing dementia, especially boxers. Look at Muhammad Ali. So they're realizing now that we need to begin to protect players. So they have more penalties now. So I guess their way of saying, if we take money from you, you'll remember not to hit so hard. So I really love that the NFL is doing their part to make the game safer for the football players. As much as I love football, I don't want the result of my passion for something to be the reason why someone else ends up with dementia or Alzheimer's later on in their life. Because taking care of my mother makes me realize I don't want someone to be this way because they chose to do something to entertain me. So I'm really glad that the NFL is taking a stand and the commission is taking a stand to make the sport a little bit safer for the athletes, because I want to enjoy watching football for many years to come. Now we're going to get into Alzheimer's dementia. Alzheimer's dementia is caused by the progressive brain cell death. Estimates range between 60% and 80% for the proportion of all cases of dementia being accounted for by Alzheimer's disease. In the U.S., about 5.3 million people are thought to have the disorder among the estimated 6.8 million individuals who have some form of dementia. That's a lot of people. These inclusions in the brain are always present with the disorder, but whether they are themselves the cause or there's some other underlying progress is still not known. Now, Alzheimer's is a little bit different from dementia. Alzheimer's ultimately will cause death in a person, while dementia sometimes will not actually cause death in a person unless there's something else that causes the dementia, like a brain tumor. The dementia itself will not usually cause death, but my mother has a brain tumor that's now sitting on her brain stem, so it is going to eventually cut off all of her functions, and she's going to go unconscious and not revive and not come back. Some of the signs and symptoms of dementia, some of the early signs and symptoms of dementia are these: recently memory loss. This sign might be asking the same question repeatedly or forgetting that you already asked it. Difficulty completing familiar tasks, for example, making a drink or cooking a meal and forgetting and leaving it. Problems communicating. Difficulty with language by forgetting simple words or using the wrong words. Disorientation with time and place, getting lost on a previously familiar street close to home, for example, and forgetting how they got there and how to get home again. Poor judgment. People with dementia, sometimes, even a well person might get distracted or forget to watch a child for a little while. But people with dementia, however, may forget all about the child altogether and leave the house for the day. Problems with distracted thinking, for example, dealing with money. Misplacing things, including putting them in a wrong place and forgetting about them altogether. Mood changes, unlike those we have, swings quickly back and forth through a set of mood. Now, my mother experiences different mood shifts and changes. Sometimes in the course of 5 minutes, she'll go through 5 different mood changes. Personality changes, becoming irritable, suspicious, or fearful, for example. My mother is constantly accusing people of taking things from her. Loss of initiative, showing less interest in starting something or going somewhere else. It is almost impossible to get my mother to try anything new, but my mother is well into the advanced stages of dementia at this point though. There's 10 things that you can ask your loved ones if you suspect that they may be suffering from dementia. If they don't get at least 7 of these 10 things correctly, you might want to get them seen by a physician or a neurologist to get some CAT scans to see what is going on. If you suspect your loved one may actually be suffering from dementia or Alzheimer's or the beginning of Parkinson's or Hopkins disease, if you're thinking your loved one may be at the beginning stage of it, don't wait, because there are medicines that your loved one can get on to actually slow the progress down. Nothing can reverse dementia or Alzheimer's. Brain cells cannot be reproduced or reversed, but we know there's a God in heaven that can heal, and He is the ultimate one that makes a decision on whether your loved one will survive this or not. So I put my mother's life in my God's hand. She's had this brain tumor for 20 years. She should have been dead at year 1, they said, because of where it is and how it progressed. But 20 years later, she's still here. So obviously, God is the sustainer of her life. And so when it is His decision that she's going to leave this side of creation, it is His decision, and I'm okay with that. My job is to love her and take care of her until that time comes. I understand my mission. These are 10 questions that you could ask your loved ones. Number 1 is, what is your age? Can they tell you their age? What time is it to the nearest hour? Number 3, you will tell them an address and then have them to repeat it at the end of asking the 10 questions. Like maybe you may say, I want you to remember 42nd Street, or whatever. What year is this? Can they tell you what year it is? What is the name of the hospital you're in if they're in a hospital? Or what is the name of the town that you're in if they're in a town? Can you recognize the people in the room with you? What is your date of birth? Number 8, what year did World War I begin? Now, if someone is not a real history buff, they may not know what year World War I began either. Most Americans have no idea when World War I, World War II, the Civil War, and Vietnam Wars actually began. We just know they happened in the time frame that they happened in. So you might want to choose something that's a little bit less challenging to ask them if they remember a significant event that makes a little bit more sense. You may ask them to name the president, or if you're not in America, or the monarch or the prime minister. But in our case, in America, we have presidents. Ask them if they know who the president is. Ask them to count backwards from 20 down to 1. And now after you get done with the 10th question, now say, do you remember the address that I gave you? If you give 1 correct answer for each point, if they score 7 or higher, then they're functioning normally probably. They just have the natural aging process going on. But if they get 6 points or less, this suggests that there's some sort of cognitive impairment, and you may want to take them to see a physician. Now, there is a general practitioner's assessment cognition test, and it is at www.gpcog.com.au and that is a test that you can take with your loved ones as a caregiver, as a loved one, that will also let you know if the person has the onstart of dementia or Alzheimer's. We're going to cut the tape down for right here now, and we're going to pick up next week with treatments, prevention, go a little bit more into Alzheimer's and into the brain disease, the stages of Alzheimer's. But we want to keep these tapes down under a time so people won't get bored watching them. We want to thank you for joining us on the Agape Project, and we look forward to working with you and your family, helping you through this crisis and making it to where you have a good support team. After that, we're going to get into getting your support team together, what it should entail, different foods and things you should stay away from depending on what your loved one is suffering with. So we look forward to the weeks to come. Thank you for joining us on the Agape Project. God bless you and have a great day. And thank you for deciding to take the challenge to care for your loved one. God bless you.